Hello, my name is Dr. Robert Purchase. I'm an orthopedic surgeon and the director of shoulder surgery at the Saint Francis Orthopedics Institute in San Francisco, California, and I wanted to present to you this case of calcific tendonitis. Now JT, she's a 42-year-old right-hand dominant female. She had had several years of right shoulder pain prior to coming into the office. We tried some non-operative care to include activity modification, physical therapy, and some medications. Now, it was clear based on the x-ray and ultimately an MRI that her symptoms were coming from calcific tendonitis. You can see that abnormal collection of calcium above the shoulder bone. Calcific tendonitis is an abnormal collection of calcific material within the rotator cuff tendon itself. Now, no one's really sure why this happens, but it's clear that when it happens, it hurts quite a lot. Now, that's the bad news. The good news is if you're able to get that calcific material out, the pain resolves pretty quickly. Now, you can try to get it out with an office injection, whether you use ultrasound guidance or not. We tried that in this case. It didn't work, so we opted for an arthroscopic cleanup procedure or an arthroscopic debridement. Any good arthroscopic shoulder surgery begins with a diagnostic arthroscopy of the shoulder joint. So here we are. The camera's coming in the back. We looked at the cup. We're looking at the ball. We're looking up at the back part of the rotator cuff, the infraspinatus. Now that's the supraspinatus, and I'm looking for clues for the abnormal calcium there, but I don't really see any. We'll come back to that. That's the biceps tendon. And now that's the subscapularis. All looking pretty normal. Like I said, I was looking for clues for that calcific tendon area while we're looking at the undersurface of the rotator cuff. You can see there's a little blue marker suture there. That was the only area of concern, that little scuffing. Now, sometimes, especially in acute cases, you can find more obvious evidence on the undersurface of the rotator cuff, but here we are. That's all I could really find that was abnormal. Now, I put that marker suture in there because I want to make sure that's the area that I look at when I get above the rotator cuff in the subacromial space. So the next video clip will be with the camera in the subacromial space, and I'm probing around that blue marker suture. And you can sort of see that, I think I'm getting in the right area. You can see a little white flecks of calcium floating around. What you can't see on this video is that it feels like abnormal calcific tendon. So once I'm pretty sure that that's where I want to go, I'm going to stick a needle into the calcific material, almost opening a little hole in it. And then once I have a couple of holes in the calcific area, I'm going to take my probe and use it to force or express that calcium out of the tendon, getting it out of the tendon area. Now, in a more acute case, it comes out like a very demonstrative toothpaste kind of material. This is a little bit more subtle. Once you feel that you've gotten all the calcific material out, you can confirm it with an x-ray. If you remember the original x-ray, 99% of the material is out. In this case, that little fleck tends not to lead to residual symptoms. And this patient's going to do very well. These patients do very well with complete pain relief and restoration of function. So I really appreciate your time and attention. If you have any further questions or further interest, you can always visit my website at www.purchaseorthoclinic.com. Have a good day.